Is social distancing bad for your heart? Well, not bad in that respect. But does it have an impact on your heart? Well, here for us to have that conversation is Dr. Stephen Sinatra. Doc, with Healthy Directions, thank you so much for coming on the show and helping us with. So I'm going to throw that just broad statement out there. Social distancing is bad for your heart. What say you, Doc?
Well, Matt, I mean, if you take social distancing to an extreme, I'm sure it can create loneliness. We can become disconnected from other people. Wearing a mask, could have a downside. I mean, think of it this way. Suppose you take this to the 10th degree, right? And you become, socially distant from people. You're wearing masks all the time, and you have young children in the house. As a psychotherapist and as a heart specialist, if young children grow up with a lot of fear, a lot of vigilance, if they're growing up with people wearing masks all the time, and if the pandemic lasts from months to a year or two, I mean, could this have an impact on young children growing up? And I think it will, because we don't want to create excessive panic or anxiety or fear in our children. And remember this, Matt. Children will follow what you do, not what you say. It's like families who pray together stay together. Families who smoke with one another, they could croak with one another. You know what I mean? I mean, so children really follow what you do. So if the adult becomes very, very fearful, puts on masks all the time, and there's a place for masks. I mean, I'm not saying that there's certain places, but when people are walking outside or walking a dog or riding a bicycle, I don't think they need a mask, especially when they're outdoors and stuff like that. And indoors, again, when you're with family members who are healthy, I don't see the need for it. But I will say this. This virus can be asymptomatic in young children and young adults. I mean, They could have a runny nose or not even a fever, and they could be carrying the virus. And if they give it to grandma or grandpa with a weakened immune system, well, then
got a problem.
Problems may occur. Absolutely correct.
But you talk about how when people get out and we are involved with other people, how that is a element of stress reduction, right? And you're making a point that, without us being able to get out and about and interact with other people, we're not having that same stress-reducing activity.
Right. In other words, you're not connecting with others. And people need vital connections in their lives. I mean, let's face it. I mean, as a heart specialist, when I would encounter a sudden death or a heart attack and the person passed and the spouse was married 30, 40, 50 years, this was incredibly heartbreaking. And I have to tell you, Matt, many times I saw a spouse, die within weeks, even within hours of losing a spouse. So, it's really important that, we support our vital connections. And the loss of a vital connection, can be devastating. But basically, I think the thing to do here is to, we want to be productive without being self-destructive at the same time. I mean, there's a role for masks, there's a role for social distancing. But again, carry it in situations or do it in situations where it really does matter.
Is there a way to compensate, though, for this lack of activity and interaction with other humans?
Well, I mean, you guys are in Chicago and it was probably a little bit cold, but if you can get outside and take a walk or walk the dog or ride a bicycle or just get outside in nature, I mean, do whatever you can. And I'll tell you, I'm a big believer in walking barefoot, walking grounded.
They call that grounding. They call that grounding.
Yeah. Correct. I've done research on that, and I have to tell you, I think if you can do a little barefoot walking. Now, again, in Chicago, it might be a little bit cold. I'm in Connecticut right now, and it's a little bit cold. But, if you can, on a warm day, if you can put your bare feet on the grass and just sit in the chair and take in the sunlight, the vitamin D. Remember that. That's another important aspect of this pandemic. I think vitamin D is one of the most important nutrients you can possibly take, and it's very inexpensive. I mean, you're talking maybe $10 a month.
Yeah, I've got some. I've got the D3.
Yeah, 2,000 to 5,000 units a day. And I'll tell you, Matt, they've done research on this, and it's unbelievable. I mean, see, a typical blood level of vitamin D in somebody living in Chicago could be like 10 to 15 what we call UGs per ml. That's one of the standard blood level. But that's not enough to fight coronavirus. It's not enough. Now, people who live in Florida, for example, where there's more vitamin D intake from the sun because it's warmer, have higher vitamin D levels. But the research on this is unbelievable. The higher the vitamin D level, in other words, if you get your blood level up to 30 to 35 to 40, the complications from COVID-19 are practically nil. And these people do very, very well. So, to spend $10 a month or $5 a month on vitamin D, it's worth it. It's very inexpensive. And I think, that's one nutrient with natural sunlight I think you can take to the bank.
All right, guys, Dr. Sinatra is a cardiologist and best-selling author of Heartbreak and Heart Disease. He knows about these serious heart issues, so look him up. How can our listeners get your book?
Oh, Amazon.com. I mean, any of my books are there. The Great Cholesterol Myth is there, and that's another thing, Matt. People used to fear cholesterol as a problem, with the heart. It's amazing. Have you ever heard of MRSA staph in children? Have you ever heard of that?
No.
It's a very dreadful infection that children get, and it can be lethal because there's no antibiotics that treat it. But what we found is that children with the highest cholesterols had the best outcomes because it fought off infections, high cholesterols. Same thing is true in gastrointestinal infections. So, if some of your listeners have high cholesterols out there and they're worried about their cholesterol, somebody will do this research. But I think going forward, maybe in this COVID-19 pandemic, higher cholesterols may be an advantage.
You know what? I'm going to have to get you back on the show because I want to talk about some other heart issues, especially like using enzymes like CoQ10 and stuff like that.
Oh, my favorite, man.
There
my
you
favorite.
Go. All right, we're going to have you back on, Dr. Stephen Sinatra.
All right, Matt. Good talking to you. God bless you, and have a good holiday.
Thank you, sir. You too. Appreciate it.
All right.